students asking again and again about what should we do immediately after the graduation. Should we go for doing a job under some supervision, or should we straight away go for opening or your our own setups or clinics? What should we do after immediate graduation?
Okay, if you want to start your own setup, you must have some investment. Always everyone say this, I also say this, but the point is that it's not about the investment which will only make your business successful or your clinic successful. It's about your mindset, your skill set, and your strategy. Strategy means that, like, if I'm a physiotherapist, and my skill set is revolving around sports physiotherapy and musculoskeletal physiotherapy, then I have to plan accordingly. If you're a physiotherapist and your expertise revolve around pediatric conditions, neurological conditions, then you have a lot of, then you have, your strategy must be different, and you have to plan accordingly. So the point is, if you want to start your own setup, then start it, but do not expect like instant results. There was a time when we used to sit in our clinic and we don't have patients few years ago, but now alhamdulillah, no day is without patient. Like, less patient or more patients, but we usually have patients in our clinic. But it's a gradual process. And remember one thing: when you think this way, that oh, you have to develop your clinical practice, and one day you will have, and you have to wait a lot of days, you lot of years. So social media is really very important. If you are confident and if you have a skill set, then merchandise yourself. In the past, there were doctors who had to wait till 40 years. Like, when the doctors, they used to be at 40, at 50, or even at 60, then they used to get their names famous, that you have to go to this doctor, and this is a very famous doctor, and this doctor has a lot of he's very expert. So but nowadays, you see, in 1, 2, or 3 years you become famous. So like, it's a positive aspect, and it's due to social media and your interaction and the platforms which you are having now. Like, in before 4 to 5 10 years, when we were students, we were not having these opportunities. And if you will ask Dr. Hassan Javed before 30 years, they were not having those opportunities we were having now, and which we are having now. So the point is that you must see the aspects and the opportunities now, and you must take initiative. And if you take any initiative, you have to stick that to that initiative as well.